Hi, this is one continuation of the series on science and history of sex, which I did for a senior learning class at USF in Florida. And before we get into sharing the slides, there are a couple of things that I will go over, which I will like to revise from the last talk. In the first class, we talked about the influence of religion and the importance of sperm and male seed that was emphasized in the uh, Abrahamic religions and led to the male dominated society in contrast to some other cultures around the world. And with the change from hunter gatherers to the agrarian society. And then we talked about the anatomy and physiology of male and female and how they differed in the origin of sexual selection occurred throughout the animal kingdom. And a couple of things that I could not share due to concerns regarding uh, copyrights was one of the most funny videos that I could not share was the Monty Python video on Every Sperm is Sacred from the Life of Brian that is available. And it's a very nice humorous take on the whole doctrine of, especially of Catholic Church. And that I think you can easily find on the Monty Python website on YouTube if you're interested in understanding the criticism of a serious issue for humanity in the typical Monty Python fashion. Okay, and some of the other sources that I have used for this research were some of the classical discussions on sexual biology is available by the erudite. I'm sharing the screen this time, and it shows the human sexual behavior. That is the series of talks on molecular biology and neuroscience by Robert Sapolsky, who is an erudite teacher, and there are a series of about 30 to 40 lectures, which were done 14 years ago, but they're still very popular and maybe of interest to some of you. So I will close this. The second source that I would use would be History of Sex by the rhetoric professor, Dr. Joanna Burke, from the Gresham College, which is an old 400-year institution and freestanding college in UK. And those are in, so this is the history of sex and pleasure by him that that may be of interest to some of you. Okay, and one lecture that I talked about was by an American researcher. That is also the slide. You can see the evolution of males and female. And she's giving a talk in the Royal Institution by Judith Menck. Okay, so that may be of interest to some of you. Okay, so after sharing this, I think I will go along with my normal slides and change my share. Stop share. And I will share the other slides issue now. Okay, that would be okay. And hopefully most of you can see the slides now, because since I'm doing this talk solo, there is no for me to verify, but I'll presume that the technology works. Okay, so we stopped at the previous slide, which was the kind of a nicknames for male and female genitals, because some of the anatomical words were considered too obscene for the Puritan Victorian society. Now, as I emphasized the importance of sperm and semen, okay, so there is a minor disease process, or actually just a variation, perhaps, that sometimes of involuntary ejaculation or intentional ejaculation that occurs with masturbation. And that was considered a big taboo and a no-no. And in the 19th century, it was considered as a mental disorder. And as the great Michael Palin talked about, every sperm is sacred. So it was considered the loss of his seed was a big heresy or taboo, and it was considered a damage to the brain. Okay, and so a restraint was advised, and not to be outdone with the female concept of chastity belts, these were devised for men as well. And so we may laugh at it at this time, but that was really a big concern to the establishment and the medical community. And varieties of measures were recommended, such as gourd baths, or perhaps, like as some wise men said, they're doing geometry or algebraic sums in your brain. Okay. And this was, again, not just the Western culture that had a big fear of it, but it was also described in the all Ayurvedic literature from India and the Chinese texts. Okay. And this was all important. Semen was secret of masculinity. And then some really drastic treatments were advocated, such as putting a ring through the foreskin, and the old standby treatment of bleeding and circumcision, and the perennial favorite of leeches were also tried. So that just took that medicine goes off on the wrong channel in a royal way. Now we'll talk about the male anatomy, but this is just the basic 101 for female sexual anatomy. As you can see that it's the all-important uterus, which is where a pregnancy is anchored, is shown in the middle. The ovaries are 2 ovaries on the side, and then the right suspensory ligaments are placed. And then obviously we emphasize the importance of cervix. And with the evolution of mammals, the urinary and the reproductive capacities evolved separately, and then the orifices were separated. And obviously we'll talk at length about the role of clitoris and in the female orgasm. Okay, so this was clitoris was described by an Italian anatomist named Rinaldus Columbus, and he called it sweetness or Venus, and he was also credited to have discovered the function. I already alluded to this, but Museum of Revising the History of Vagina in Camden, UK. And now the ovaries, which cannot be seen in the side section or the lateral view, as this is, but in the frontal view, there will be apparent, and the 2 ovaries, which are the size of an almond, and which has the ovocytes and responds to the various hormones, estrogens and progesterone. Okay, and these are transmitted via oviduct and released, as we already talked about. And the fimbria of the ovaries, which are like a catcher's mitt, and then the shedding of the endometrium that explains the menstrual cycle. Okay, and then again the controversial thing, which the argument still hasn't been resolved, at the 17th century Dutch physician Regnier de Graaf described female ejaculation and referred to an erogenous zone in the vagina that he linked with the male prostate. And this zone was later reported by Grafenberg and was termed G-spot. This was a relatively recent term that was coined in the 20th century, and so that was in 1950. Grafenberg stated an erotic zone that could be demonstrated in the anterior wall of vagina. along the course of urethra. It is typically located to be about 2 to 3 inches for the American audience and 5 to 8 for the rest of the world in the front of the front, that is the anterior wall of the vaginal orifice and urethra. It is sensitive, okay, and so similar to prostate in male. Okay, but again, some of the authorities are still, there is a controversy remains as to whether that it really exists or not. So even after 400 years of dissection, we are still not completely knowledgeable about the human anatomy. Okay, and obviously this is more of a cartoony type of diagram of the microscopic world of male and female reproductive organs. And as I mentioned earlier, a lot of this talk is done by University of Adelaide, and they have a whole series of embryology lectures at University of New South Wales. Moving to the left side, the ovaries as a cortical layer, and around in which there are varieties of cells called oocytes that are responsible for the release of eggs every month. And the testicles, there are varieties similar to kidney structure. There are varieties called, there are glomerular tubules this way. Similarly, there are seminiferous tubules, and that are convoluted, and they're released. There are stem cells which form sperms. The onset of the process in females starts at puberty, and decreases with the age of menopause. And the release of the gametes is once a month, and during the reproductive cycle, and basically it ends at the menopause. Okay, similarly in males it starts and with puberty and continued onwards, but lifelong basically. So okay, so this is, the two sexes have a different sexual cycle. That's why men can have children even at age 70, except to quote the joke from the well-known American humorist Billy Crystal. Yes, Charlie Chaplin had kids when he was 75, yes, but he couldn't pick them up. Okay, now again, that with the bipedalism, breasts became a lot more prominent and involved in the sexual intercourse. Now, this is just a basic myths or knowledge base that I borrowed from Dr. Joanna Burks as to why do boys have nipple. Okay, these develop very early in a fetus's life. This is before the sex determination, so they are kind of remnants. And the only disadvantage is that although rare, males can develop breast cancer, and obviously since the breast tissue is relatively small, that can be very lethal. So fortunately, it is very rare, but it has been known to occur in medical science. And what are breasts made of? They are not just made of fatty tissue. They're made of varieties of cells called epithelial cells, lobules, ducts, collagen, and adipose tissue. Along with there are the milk duct, the lactation ducts that are formed. So, and when do breast buds develop and why? They develop very early on at the age of 8 to 13, and then progress further in size due to rising levels of estrogen and progesterone have an effect on all of us. Now, what causes the change in size and shape? It's a natural variation. It has no effect on the function. Okay, and the most important point that one has to emphasize that the increased number of menstrual cycles have an increased risk with the cancer. Okay, so there is, reproduction and having many children has a beneficial effect. And as women delaying their children and having more and more cycles, the hormonal swings up and down may have something to do with the risk of breast cancer. And again, that was well apparent apparent with the discovery of birth control pills, that the earlier pills, which had higher levels of estrogens, had an increased incidence of breast cancer. Okay, and then and the word itself, mammals, is has its origin with off breast, so you can just say mammary gland, and then there was a lot of misconception about milk, whether there was concocted blood, and the male breast are vestigial organs, and so the status of breast has changed from nurture and feeding, and as considered a normal part. So you can see that a lot of the hunter-gatherer cultures, and even some of the earlier cultures, the breasts were not covered necessarily, and the thinking change, okay, with the Western taboo about exposure to breast, and from there, from nurturing effect, it changed to the erotic effect. And obviously, through the classical periods of the varieties of painting, the Renaissance, and even through the Enlightenment, it has become a big business in terms of and the male fantasy. Sometimes, it focuses on the appearance, because we are all, as a human beings, we are a very visual creature, and obviously the curvature of the breast, becomes a very attraction per se. And a lot of societies, the being topless was considered illegal, except in some Central European countries. Nude bathing became popular, especially in Central Europe, and the clothing. Okay, that even during the rise of the Roman era, when the sea trade was in existence from China to India to Europe via the Mediterranean. Okay, the great Pliny, the historian, lamented upon the indecent see-through dressing in the fashion of silk robes that was apparent in the well-to-do Roman society. So he lamented, just based on the baseness of cost that was incurred in importing silk. At the same time, modesty that didn't exist. So the double standard has a long-standing history. Okay, and I showed the earlier slide about the male swimming outfit. Now, then it took, because of the round and three-dimensional shape of a female breast, it was really a challenge, and I think, if I recall correctly, the design of brassiers took really a creative genius, and it considered it's a very technical and topological challenge. When you localize that the surface that you're trying to cover has varieties of shapes and sizes, so it requires a huge number of fragments. And it is almost like Buckminster Fuller, if you remember the geodesic globe, so it requires a very soft engineering of material, about 30 to 40 separate pieces, including underwires and strap adjusting sliders. So, and obviously, instead of the pointy bra that was burned in 40, 50 years ago, the Victoria's Secret made a big business out of it, and what was considered underhand in a brown package selling became a big glamour item, and that just by sheer coincidence, a recent history of the business of Victoria's Secret was well summarized by two ladies in the book Selling Sexy, as to how business remained popular for 30 to 40 years. And but I think we are digressing. So, okay. And then obviously the breast cancer surgery was practiced even in the Egyptian era, that one of the Egyptian queens had breast cancer. So that is not a new disease. And this was well summarized by the American physician scientist on history of cancer that he wrote a book, I think, in 2016 called Emperor of Melodies. So he describes that the cancer is a very old disease. Okay, and with the surgery that was recommended was obviously the diagnosis was difficult, and later on with the disfiguring of surgery that took place, and the whole history of breast cancer is extremely interesting and really realizes by the aggressive approach that was taken by the Johns Hopkins surgeon, Dr. Halsted, who suggested a radical mastectomy, and the usual panache of American medical system of declaring war. And so it was literally a war on cancer and trying to eliminate all cancers without realizing that all it takes is a one rogue cell to restart metastatizing. So, and we recall the destructive effect that caused with the obstruction of the lymphatic drainage that took place. So there is an interesting history of breast cancer surgery, but again, I don't want to digress too far from this. And last but not the least, I think those of you who are living in the United States would recognize that the wardrobe malfunction that occurred during one of the award shows in United States, and the popular singer named Miss Janet Jackson's breasts were exposed. Obviously, that was an accident, and that caused a big uproar to the American society and led Congress to pass laws about having a slight delay in broadcast thing. And I think, if I recall correctly, the network was penalized as well. So, okay, so this is, and so this was one of the big cultural event in the United States again. And again, obviously, and we can talk all at length about the breastfeeding and the wet and cross nursing that takes place, and storing the milk. So it's an altogether, and milk has varieties of immune proteins that gives the infant head start. So again, one cannot overemphasize the importance of breastfeeding. And at the same time, there are certain medications that can cause gynecomastia, that is enlargement of breast in males, that can be a very unpleasant and unsightly side effect, which can cause to a lot of psychological barriers to men who suffer from this side effect. Okay, and again, so this was the earlier, there has been an obsession with breast, and you can see the advertisement industry was right on the tail. This from the late 19th century or even early 20th century. There were all sorts of quack remedies that were promoted for breast enlargement and creams, and so women have been subjected or have willingly indulged in the personal esteem of enlargement of breast. And again, and there is a recent book that was written by a well-reviewed book by Marilyn Yalom, and that's the history of breast. It was published a few years ago, I think, and these are the varieties of chapters she goes along with. So it would be hard to imagine that one could write 300 pages on history of breast, but there you have it. And in the artwork, obviously, it goes from the classical Renaissance painting of Holy Madonna to the popular rock and pop singer, and also named by coincidence Madonna, okay, who made a whole career out of promoting her bustier, and to the another Hollywood actress, Angelina Jolie, who had a huge impact on the genetic screening of BRCA gene, which is responsible for breast cancer, and agreed to have prophylactic bilateral mastectomy, and that has had a huge impact on women who agreed to have disfiguring surgery. Okay, now getting back to the basics that we talked about, sex, that sex has been investigated, the physiology has been investigated, at least in the 20th century, by a well-known naturalist, zoologist, or anthropologist rather, Ernest Boas in 1930s. And people have tried to make various physiological response during sexual intercourse, that they tried to measure the heart rate response. As to now, those of you who are familiar with exercise testing, which is done for diagnosing heart disease, well, the terminology that is used is called metabolic equivalent. Okay, at rest, what is almost 1, and when you do light exercise, it's up to 3 to 4 METs. Vigorous exercise can be anywhere from up to 8 or 9 or 10 METs, even metabolic equivalents. And this was done very scientifically by measuring oxygen levels, while you're actively exercising, and was calculated based on body weight. Okay, so to make the long story short, the heart rate response during exercise, primarily for male, it can be classified as light exertion from anywhere from 2 to 3 METs. And so this was the study that was published in 1956 with the impressive title of Physiological Response During Coitus. Okay, so one can still look up the paper. And at the same time, the physicians who have looked after older men, do have encountered that men could actually get heart attack during sex. Either it's due to excessive cortisol, dopamine, or just sheer coincidence that matters. And this was a difficult advice for patients who were recovering from heart attack, as to whether a lot of physicians were skittish about approaching this to patients. But again, one patient should be cautioned that yes, there is a small but definite risk that your heart rate will go up. And obviously, the screening and rehabilitation plays a role. And traditionally, it was advised to abstain from sex for at least a few weeks after heart attack, just for safety's sake. Now, the treatment has dramatically changed with the interventional cardiology that takes place. So I think that becomes a relic of the past. And even during that, the position during sex matters as to the male on top versus female on top. So it is. But it's still uncommon to rare. Okay, and so this is, again, people have recommended, tried to document even other data other than heart rate, which is like recording the blood pressure during orgasm, or respiratory volume and heart rate during sex. So varieties of scientific data has been collected, and so this is an interesting scientific study of a normal physiological phenomenon. Okay, and there's okay. So moving on further, I think probably taking more time. So the quote from Human Sexual Response. This is a classical book by Masters and Johnson. The artificial coital equipment was created by physicists. The penises were plastic and had the same optics as plate glass for observation and recording, and the rate were controlled by the subject. So this was equipment useful for varieties of research that was done. Okay. Now, again, the attraction, we'll just change subject as to what do women want. So there were this couple of articles in the well-known British newspaper, The Guardian. You can just see how men have the so-called wandering eye. And at the same time, there was a study, I think, by Dr. Judith LePage, who we talked about, who's a very colorful scientist. And what do men want? This is, obviously apparent as to, we talked about it. And on the other hand, what do women want? No, they want good genes. Or now, is it necessarily, like somebody who is virile, has long hair, which is an attraction in itself, at the same time, a strong muscular physique, okay, and at the same time, a good provider. And so that's an interesting mixture that, and at the same time, being okay. And Okay, I think this may be, hopefully I should be able to show it without incurring copyrights, so let's see.
Black and white, and attitudes towards sex were too. Their book, Human Sexual Response, detonated rather than just appeared.
Masters and Johnson's work was sprung on the world in April of 1966 to a great deal of shock.
Dr. Robert Kolodny worked with Masters and Johnson for 30 years.
The fact that a physician and his research assistant at that time had been doing laboratory studies of people actually having sex was eye-opening.
They seemed so tame. Dr. Bill Masters and Virginia Johnson deliberately cooling down a hot topic.
If one's looking for pornography, it's going to have a long look.
There's nothing of a very exciting nature in this book.
Oh, but there was. And to their own story as well.
Masters and Johnson dealt with virtually every aspect of human sexuality.
Thomas Mayer wrote a biography of Masters and Johnson.
Instead of the male being the more powerful of the sexes, what they were clinically showing was that women actually had a greater capacity for sex. They found out that older people can enjoy sex.
Mayer's book inspired the Showtime drama Masters of Sex, which shows in pretty steamy detail how exactly gynecologist Masters began his research in 1954, observing prostitutes. Their studies were conducted in absolute secrecy at Washington University in St. Louis.
If I can make the camera small enough, they will allow the viewer to actually witness it in real time.
To discover what happened to a woman during sex. Soon after he hired Johnson, a divorced mother of two without a college degree, Masters pressured her to have sex with him.
Two of us should undertake the research ourselves.
As part of their work.
She said that she really didn't want to have sex with him, but she didn't want to lose this job.
In today's terms, that would be.
Yes, definitely would be considered sexual harassment.
But in 1970, Masters divorced his wife of 29 years and almost immediately married Johnson. By then, their names had long been linked professionally. Masters and Johnson, like Procter and Gamble, a brand.
So you would argue that Virginia Johnson deserved the equal billing she got in Masters and
absolutely.
Johnson, even though she didn't have a college degree.
Absolutely. Her signal contribution, to my mind, is that she played a very key role in designing the approach to sex therapy that they took.
Then the prevailing success rate for treating sexual problems may be 15%. They reported an astonishing 80%. The best part, the treatment only took 2 weeks.
They taught couples how to touch one another again, literally how to communicate physically, where it had broken down.
Playboy's Hugh Hefner helped bankroll their work. As the national dialogue about sex became more candid, they informed the conversation.
You have just done what Masters and Johnson would call a premature ovation.
The laughter was good-natured until the publication of their book on homosexuality in 1979.
I assume you consider it a key finding, which some people are surprised at, and some people seemingly are disagreeing with already, that you can convert people who want to be converted from homosexuality to heterosexuality.
Actually, this is true.
Masters was ridiculed, his conversion results questioned.
Do you, in your heart of hearts, believe that at some level, Dr. Bill Masters exaggerated,
Yes,
fabricated?
Oh, at the least exaggerating.
And then came the bombshell. The couple who taught other couples about sex was getting a divorce. In 1992, after 21 years of marriage, Masters left Johnson for another woman.
Regardless of the tragic way their love story ends, fundamentally, their story is about bringing medicine and science into the discussion of sexuality.
Masters died in 2001, Johnson in 2013. Their once famous names practically forgotten.
Okay, so they were the pioneers in more than they had a giant shadow across. They talked about arousal, cycle of excitement, the pleasure, orgasm, resolution. So this was this was the classical way of describing it. The more recent way of one can say is information processing in the brain, arousal, incentive, the genital response, and obviously there is a increase of autonomic activity, and there is a complex interplay of nerve endings, neurotransmitters, okay, that takes place. So the science is extremely complicated and interesting in much more detail than they obviously there are limitations at that time because they did not have access to molecular biology and neuroanatomy in details. Okay, and now this is again, interesting study. I'm not sure as to where this was, now as we talked about, they had built a penis camera. Vaginal and clitoral orgasms were basically same, and they proposed varieties of explanations for penile traction on labia, pulled on clitoris, and they also described various phases of excitement, plateau, orgasm, and a kind of a refractory period response, which differs in male and females. Okay, and you can see that the diagrams are pretty self-explanatory. Okay, and because the males have need time for rising to the occasion again at the same time, and the female response time is different. Okay, and so this is. Now, we were talking about the foreplay, which is not a uniquely human gift, or bonobos, our cousins have it longer. And so this basically evolved, say, about 65 million years ago with the rise of mammals. And so their classification was the excitement, plateau, orgasm, and resolution. So it explains how the excitement is the first phase that occurs when the physical and mental stimuli raise sexual arousal. Sex is the P phrase, okay, which is where the arousal becomes intensified. There is increased circulation, heart rate, respiratory rate goes up. O is the orgasms phase, which is relatively short. It's characterized by intense pleasure in both males and females. And there are quick muscular contraction in the lower pelvis muscles. In the male is associated with ejaculation. Finally, R is the resolution phase. While the muscles relax, the blood pressure drops to the pre-excitement level. And men, obviously, as there is a refractory period, as we talked about a little while ago, and and the sexual re-arousal and orgasm is not possible in women. That is obviously not the case. That's well known to most adults. Okay, and phase one, there's myotonia, its muscles get strong, nipples and breasts change, penile and clitoral erection, lubrication, flushing, blotches sometimes can appear on people with lighter skin. All the three basic parameters of physiology, heart rate, blood pressure, and respiratory rate increase. And then further out, the vaginal anatomy changes. The labia majora flatten and thin out. And the source of lubrication is not necessarily glandular, but in plasma. And there is also increased capillary flow. Okay, and there is oxytocin stimulation that takes place, and there are varieties of other acts that are involved, which is basically touching the breast, licking, fondling, okay, or even biting them. So a lot of the research is done by very scientifically and clinical approach, which is called photoplethysmography, which is measuring the actual parameters and blood flow, etc. And women's arousal to porn is non-discriminatory, while males is more selective, you know. So this was, and so, and the reward that occurs is almost like the effect, like almost like a drugs stimulating drugs such as cocaine on the brain. So that is definitely a dramatic physiological effect that takes place not just in the genital or area, but also in the brain, and is stress relievers. And this is, and so this is an example, a more detailed example of phase 2. Okay, and as we had talked about when we talked about testicles, they withdraw into scrotum, and outer vaginal wall gets engorged. Okay, and the labia minora enlarges about 2 to 3 times. The colors may change. Okay, and then there also I described a little while called vaginal tenting that takes place, which anatomically is beneficial. That creates a what we call a seminal reservoir. Okay, so and that's are just some of the more detailed examples, you know, like starting from the wetness in enlargement and expansion that takes place. There are varieties of contractions of the muscular structure that takes place, and there also contraction of the uterus can take place. So this is, and again, this is a lot of this is influenced by varieties of hormones, primarily oxytocin and prostaglandin in males that takes place, you know. Okay, so and and then last but not the least, orgasm phase 3, which is involuntary muscle contraction. You know, again, the rise of the 3 parameters, the rise to the peak, sudden forceful release of tension, and again muscle contraction. And the myths about orgasm was linked to fertility dates, owing back to the father of modern medicine in West, Hippocrates. Okay, and it took until 18th century research and varieties of animal experiments by the Italian anatomist Spalzoni to prove that that was wrong. And the word was coined was coitus, which was as origin to Latin language, and which means come together or joining. So how the language has evolved and become part of the normal conversation or modern English. Okay, and so we already talked about that, you know, so that thing. So, and some of the studies was done as recently as 1950s in primate studies with at the University of Illinois in the United States, you know. So fertility is not necessarily dependent upon female orgasm, but it does facilitate it to some extent, you know. Okay, and this is also shown in our cousins, monkeys and apes. They do show orgasm. So this was published, and the American Puritan Culture, when the first paper on this on rhesus monkeys was published in Science magazine, they had to put a disclaimer that no federal funds were used in this research. Okay, so science was handicapped by the societal mores. Okay, and we again this elaborated on the phase 2, the gradual return to normal, and again there are multiple organisms that women can experience while men have the refractory period. And this is again, you know, I'll just try to see if I can show this. Okay, desire for current women on the pill, women not on the pill, normal cycling. So you can just see how the response can be a little different. And then many times, you know, after the post-ejaculatory phase, the men's glands, which is the skin on the penis, is become sensitive. Okay, and this again literally, you know, orgasm, you know, has effect on your brain. Okay, and that's a lot of the attraction in orgasm is related to our culture, and as to people can get excited by varieties of things such as clothing, hair, cosmetic, music, candles. All these have effect. So and sometimes, you know, there are varieties of disorders. I wouldn't say necessarily illness takes place in men. They can suffer from premature ejaculation or lack of orgasm. So this is And there is also varieties of higher centers of brain, which is the so-called limbic system, are involved. Okay, and usually, at the time of ovulation and second peak at day 24, there's a better chance of orgasm. So extensive research has been done. For those who are interested, can share some links. Hopefully they'll show up in the notes okay. And again, like the fake orgasm, hopefully I can show this, probably without, okay, I'll stop the share and see if I can share a different part. Okay, let me see if I can get this scene up. Okay, this was a popular movie from 30 years ago type of thing, and then hopefully this will show.
I'm so glad I never got involved with you. I just would have ended up being some woman you had to get up out of bed and leave at 3 o'clock in the morning and go clean your andirons. And you don't even have a fireplace. Not that I would know this.
Why are you getting so upset? This is not about you.
Yes, it is. You are a human affront to all women, and I am a woman.
Hey, I don't feel great about this, but I don't hear anyone complaining.
Of course not. You're out the door too fast.
I think they have an okay time.
How do you know?
And how I know.
Because they.
Yes, because they.
How do you know that they're really?
What are you saying? That they fake orgasm?
It's possible.
Get out of here.
Why? Most women at one time or another have faked it.
Well, they haven't faked it with me.
How do you know? Oh, right. That's right. I forgot. You're a man.
What was that supposed to mean?
Nothing. It's just that all men are sure it never happens to them, and most women at one time or another have done it, so you do the math.
You don't think that I can tell a difference?
No. God, no. Mhm. Mhm.
Okay.
Oh. Oh, God. Ooh. Oh, God. Oh. 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 Oh, God. Oh, you're right there. Oh. 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 Oh, God. Oh. Yes. 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 Oh, God. Oh.
I'll have what she's having.
Okay, so I'm sorry to take up time. Some of you may have already seen it, but I thought it was kind of funny and will break up the seriousness of our talk. So I will stop the share and go back to my usual share if I can get to my second screen. Okay. Okay, so here we go ahead with the and peak sex exercise at mid-cycle is now one can wonder that is female orgasm a spandrel. Now, obviously, I mean, if you know architecture, you may know the word spandrel. Spandrel is a product of evolution, so to speak. So, and but And so that remains a conjecture type of thing. So for example, like, or is that just a byproduct of evolution? Okay. And so this is, now at least there is some evidence that in male during orgasm, there's larger volume of semen that is produced. There's a lot of role of autonomic nervous system. So there are a variety of sacral nerves. These are the lowest part of your spinal cord, the sacral nerves that innervate your genitalia. And so this is, and there are varieties of weird case reports that are reported in the medical literature that sometimes some people can get orgasm with, a really simple act type of thing. So this is such as some women have experienced it with brushing their teeth or stroking the eyebrow or something, but those are rare and probably just an anecdotal case report. So this is almost like a Lazarus reflex. Okay. And so that's, so a lot of medical literature that is in, but that we shan't reckon to it, so this was, around, the science of orgasm. This was books that have been written for a long time. Okay. And sometimes, there is a death rate has been reported with time. Okay. And we already talked about that relationship with exercise. Okay. And we talked about, the peaks of fertility that can occur, related with ovulation and peak. So, okay. Okay, let me pause this for a second and I will. Okay, the variety of definitions have been given. The simple thing was initially starting with the early researcher Kinsey, who described it that occurs at a peak of sexual response. Then Masters and Johnson defined it as a release of vasocongestion and myotonic increment in response to sexual stimuli. And now, as research becomes more available, the more recent definition would have to be, that a variable transient peak sensation of intense pleasure causing altered state of consciousness, accompanied by involuntary rhythmic contraction of pelvic striated circumvaginal muscles with concomitant uterine and anal contraction and myotonia that resolves sexually around vasocongestion and myotonia with general induction of well-being and contentment. So that's quite a mouthful, but that's a typical medical jargon, which you may or may not care to indulge in. Now, there are varieties of weird words that are sometimes occur when you are researching some of these subjects. These are the several words that, which a couple of them may be well known, but the other ones, would stand to be defined, And there's actually a blog spot that in 2013 that by a lady named Elaine Davidson that I came across, so that she defines this movement, okay, and satyriasis, okay, and okay, and she described this as uncontrollable excessive sexual desire in men, which is, half man and half beast, so this was one way of defining it. Okay, onanism has, when Onan had sex with Tamar, in the classical mythology, he withdrew before the orgasm and he spilled his seed for heavens or semen on the ground, since any child would not be considered, legally to be his heir. The next statement in the Bible says he did evil and God slew him. Okay, and obviously nymphomania is well known. Okay, about the excessive desire in women to have sex, and infibulation, that's the horrid practice of excising clitoris and labia of young girls, or even worse, stitching them together to prevent intercourse. So that is, and impotence is well known. It can be a ground for divorce, and and obviously that the male desire for losing sexual potency. That's a big business, and that led to the rise of Viagra. And I think some of you may not be aware that the Viagra was originally the chemical was designed for relieving chest pain or relieving pressures in the pulmonary artery. And some of the patients who were veterans, who were part of the trial, reported that they were experiencing erection, and the side effects were a lot more profit generating for the company, and that they decided to market it for male sexual treatment for impotence and erection. And so ED became a new disease that was heavily promoted. And there was a very humorous movie that came out not too long ago about a salesman who was selling Viagra. Okay. I think it was starring Ryan Gosling and one of the American actors. Okay. And again, so this is, obviously the phallus is defined as the term from erect male penis, and that goes back to the early days of art. Okay. Okay, and now here was, fertilization. This is, let's getting back to more science rather than sex act per se. Okay, and during the sperm activation or capacitation, the membrane of the sperm head becomes less stable, which releases varieties of enzymes and causes varieties of reaction, and the tails become more frantic. And once activated, ready to meet the eggs, okay, and they have to navigate along the long passage, okay, and involves penetrating, zona pellucida, as we talked about, and binds, and the varieties of receptors takes place through the lock and key mechanism, so which brings about the third stage, which is called the acrosomal reaction. Okay, and it forms spores inside the membrane. Varieties of chemicals are released, and then the enzymatic digestion in the tail enables the sperm to pass through the space, and that stage is set for fertilization. Okay, the head is removed, it binds with the oocyte plasma membrane, and the tail becomes, the egg calcium levels rise, and that creates a barrier that the other sperms cannot enter. Okay, and that subsequently takes almost 9 to 10 days for implantation. Okay, and okay, so let's play this. I described it in more detail. Here, the sperm is trying to penetrate, and as we told, something called the acrosomal reaction. That's a chemical process that takes place, so how it creates a hole. I think that's, that's the end of the tapes, basically. Yeah, I think that was at the end of the tape. So okay, this is a tape for
The
implantation.
zygote that is formed following fertilization remains within the zona pellucida and begins to move along the oviduct to the uterine cavity. A lot of significant changes take place during this journey, which will be outlined in this video. First, cleavage division occurs during day 1 following fertilization, and the 2-cell stage with 2 identical blastomeres is formed. Blastomeres are the cells that are produced during cleavage of a zygote and that form the morula, which is a solid ball of identical cells. Following this, there is further division to 4 identical blastomeres. After 3 days, the blastomeres undergo compaction. There is no increase in the overall size of the conceptus during this time. Rather, the cells become smaller. The morula typically reaches the uterus on day 4 and the cells have continued to divide. Over the next few days, these identical cells divide further, forming a blastocyst, which is a hollow ball with an inner cavity containing nutritious fluid called the blastocele. It is important to point out that the wall of the uterus contains glands that secrete nutritious fluid, which initiates the formation of a blastocyst. Some cells are displaced centrally from the periphery of the blastocyst and become the inner cell mass. Cells are no longer identical in size and shape, with 2 different populations now present. The next stage is called hatching. By the end of the 5th day, the blastocyst is now ready to implant into the uterus. Its protective zona pellucida thins and ruptures. The zygote that is formed following fertilization remains within the zona pellucida and begins to move along the oviduct to the uterine cavity.
Okay, so this is basically it from the University of Australia that it took place. Okay, and this is an interesting research that was done for Center for Sex and Culture that was started by Dr. Carol Quinn. Okay, and this was in a work for study of human sexuality for a number of years in California. Okay, and that finally, unfortunately, had to fold. So they did some good research. So this is varieties of models have been proposed of since Master and Johnson. The research has continued. Okay, the Singer's model, and as you can see, as recently as 2009, the active research on human sexuality has continued. Okay, and now there are some dictionary definition for electroejaculation. Okay, now that's that's getting into it. This was done by a British researcher, and they were trying to help out people who had spinal paralysis and had difficulty with enjoying sex. Okay, and so this was done with varieties of methods, initially with chemicals, drugs such as papaverine, which had some side effects, and later on.
Which are used to obtain semen samples from sexually mature male mammals. The procedure is used for breeding programs and research purposes in various species, as well as in the treatment of an ejaculatory dysfunction in human males. Electroejaculation is usually carried out under a general anesthetic. An electric probe is inserted into the rectum adjacent to the prostate gland. The probe delivers an AC voltage, usually 12-24 volt sine wave at a frequency of 60 Hz, with a current limited to usually 500 milliampere. Although some devices can generate currents of up to 1A, the probe is activated for 1-2 seconds, referred to as a stimulus cycle. Ejaculation usually occurs after 2-3 stimulus cycles. Care must be taken when using currents greater than 500 milliampere, as tissue burns may result due to heating of the probe. The stimulus voltage stimulates nearby nerves, resulting in contraction of the pelvic muscles and ejaculation. This procedure is used frequently with large mammals, particularly bulls and some domestic animals, as well as humans who have certain types of ejaculation. Electroejaculation has also been used for cryoconservation of animal genetic resources where one would collect semen and store it in low temperatures with the intent of conserving genetic material and future revival. In the practice of veterinary medicine and animal science, it is common to collect semen from domestic ruminants using electroejaculation without sedation or anesthesia. Only in goats is mild sedation sometimes used. Because of the significant skeletal muscle contractions it causes, electroejaculation is not used in stallions, except in rare cases, under general anesthesia. The procedure has been adopted and modified as an assisted reproduction technique for managing endangered species, to ensure the production of offspring from incompatible pairs of animals where artificial insemination is feasible.
Okay, so, and now there are a simpler alternative with something called transcutaneous nerve stimulator, and there is even a company that is commercially marketing it, and there is a website called medicalvibrator.com that has additional information. Okay, and then again, the spinal cord injury has effect on sexual performance, causes autonomic dysfunction. There are varieties of nerves that I talked about earlier called sacral plexus. Okay, in this area, usually in the classical anatomical textbook, nerves are depicted in yellow, and so there is a role of sacral plexus. There is a combination of nerves that takes place, and this is now not all patients with spinal cord injuries have impotence that a problem, but 40 to 50% are still capable. So not all the nerves are affected. So, and there are some of this stuff is kind of preserved in paraplegics, that and sometimes, in a simple other bodily functions such as going to toilet can cause orgasm, okay, and sometimes can occur even in spontaneous ones, so this reflex sometimes can be present even in brain dead patients. Okay, so this is, and then a lot of the medical students are taught to check for reflexes when physical exam was invoked, and the word that is used is called cremasteric reflex, and the word is obviously, it has a Greek origin. Well, I hang or cremasteric response, pulling up of testes when the inside of the thigh is stroked. So that shows, as to how the nerves and organ connectivity is preserved. So that's a bedside way of assessing the integrity of the nerve function. Okay, and this can be useful in diagnosing rare conditions such as testicular torsion or twisting that takes place sometimes. Okay, and this is, sometimes, varieties of sex machines have been devised for a variety of people who are like a gas trinkerers, that they were devised, so, and some of them have actually been successful, and they've taken out US patents. Okay, and we already talked about the journey of the sperm that we talked about from testes to the vas deferens, which is the tube, and that is used for male, contraception. The vas deferens, that's right under the skin in the inguinal area. So where it is snip and cut surgery that is done. And that's a relatively easier procedure, but a lot of men have misconceptions and are reluctant to undergo it for birth control. Okay, now the most important organ for sex, one has to say that obviously the anatomy of male and female sexual organs is important to understand, but brain, at least, has a huge role in human beings. So the varieties of hormones are incorporated, starting from the, this is called the hypothalamus, the pituitary axis. So this is, the master control, which releases hormones such as called gonadotrophin release hormone, that in turn affects the pituitary. So there are varieties of feedback mechanisms, and pituitary is the so-called master endocrine gland that releases varieties of other hormones, One is called FSH, is stand for follicular stimulating hormone, and LH is called luteinizing hormone that affects the varieties of cells. Sertoli cells are in your testes, okay, and these are in your ovaries, the Leydig cells, okay, which again produce the Sertoli cells. Sorry, I misspoke, and so they are in the female. Because my mistake or my bad is the current terminology is it stimulates the estrogens and the Leydig cells, which are in the testicles, cause the spermatogenesis, okay, and then again, that goes on, and there are varieties of feedback mechanisms that takes place as the effect of the hormones goes back and affects the pituitary. So there's like a lot of the endocrine cycle is controlled with so-called feedback loops, and the color coding is pretty self-explanatory. The male is the blue one and the female is the red one. Okay, so the early research was done, a lot of things was done in spading animals, starting from cats and dogs. Okay, so turn off the ovarian removal. Okay, and then some of the research was done by implanting estrogen pellets into the brain, and they become hypersexual. So again, so this is, and there are varieties of changes that takes place, with the ovulation cycle, as well as, with a pregnancy and childbirth. For example, this may come as a surprise to you that the testosterone level will drop in men when they become a parent. Okay, and then this has an effect even how the brain is intensely connected. That even if you are a big sports fan and when your favorite team loses, your testosterone may drop, and it's very hard to define as to what exactly is the normal level, because it can vary considerably. And there is a interspecies variability. So that, and again, the varieties of the hypothalamus is the area of the brain which has a huge involvement. There are varieties of, this is right above your optic chiasma in your brain that is situated. It's the hypothalamic area. And again, in males, the area is larger than females. Okay. And there is, there are varieties of differences anatomically that takes place. One, to be politically correct, we like to say there are no differences, but there are clear-cut anatomical differences. This is like a humorous take on the male and female brain. Obviously, the male brain is focusing on sex and other areas, while the female brain has a lot more variety. So I think, that one should not take that too seriously, but just thought that would break up the monotony or dullness of the talk. Okay, and then so this is again, we're hardwired that sometimes young boys will prefer toys of trucks, and girls would genetically go for dolls. Okay, and so this is at the same time, so and there are other regions of the brain which are the higher levels, called insular region. It lights up with emotional aspect of it, and the frontal part, well, so even it's just because even if you're lusting after a person, you're not going to go out and grab. So there is like a frontal part is like the master control mechanism that affects the behavior. Okay, and there's a joke that is associated with Calvin Coolidge, who's called the Silent Cal, one of the American presidents. Okay, and then they were visiting a farm, and I think the pig was having, or the bull was having sex with cows, and Mrs. Coolidge was says, go ahead, tell that to the president, and the president replies that yes, he was having sex many times, during the day. Okay, but Calvin Coolidge's tongue-in-cheek replies was it was not with the same cow. Okay, so that was a joke that is associated with Calvin Coolidge. I don't know whether it's true or not, Okay, but there you have it. So the sex and brains, so this is again, these are the varieties of areas that we talked about a little while ago. The prefrontal, the varieties of amygdala, the hypothalamus is, in the central area, right in the green, that is the lower part below the optic chiasma. Again, this is a side view of the brain. and the amygdala, which is associated with the nuclear accumbens, and the prefrontal cortex, which is the master control. Okay, and this respond to varieties of hormones. The dopamine activates the reward system. Oxytocin, promotes the dopamine release. Okay, in new moms. Okay, and that's basically the two hormones that are involved. And the vasopressin is also involved, which is like the antidiuretic hormone. Okay, and this is and the prefrontal area that I talked about just a little while ago. So this is all a complex cycle that your brain is the master organ. Okay, and so sometimes like the old Heinz commercial, the anticipation, the relationship is the price that one pays for anticipation. So, and again, this is research is done for the animals, that and the area which is the stimulation of the brain, it is done with electrodes in animals, rats being the test object. The rats will press the lever of which gives them the shock and releases the dopamine about many times at the cost of not even eating. So arousal, so this is the control is from the top down type of thing. So the varieties of areas that we talked about, okay. Okay, and so we and then brain plays a role, is affected by the side effect of dopamine in Parkinsonism, because Parkinsonism is a disease of the brain area of your where your substantia nigra degenerates and there's not enough dopamine, and they're suffered with stiffness, and so they are treated with dopaminergic drug. Okay, and that this one of the side effects is that some of the older, relatively normal appearing men, they become sex addicts or even gambling addicts, which gives them, and a great dopamine surge type thing. So this is, again, and a lot of this dopamine release has, to do with varieties of fetish disorders that take place. Again, so sometimes it can be very weird as to how the brain responds to certain stimuli. For example, some men have had a fetish with boots. Okay, and this was well illustrated in the movie Kinky Boots. Okay, and there are varieties of receptors that are involved in it. The dopamine 1 and dopamine 2 receptors that are related to bonding that takes place, and general establishments of empathy. And now, when it comes to pregnancy, there are varieties of hormones that are involved. Now, the main ones being progesterone and estrogen, okay, and then a prolactin, which is involved with secretion of milk, okay, and oxytocin, which is helps with the onset of labor and delivery, okay. Oxytocin, so that is quick birth, which is related to uterine contraction and milk production. Okay, so these have been associated with affecting the mother's brain, and a lot of these were discovered by a British neuroscientist named Dr. Henry Dale, who went on to receive Nobel Prize. And varieties of he also discovered the other hormones which we know about, such as histamine. Okay, and all these hormones have an intricate relationship with varieties of sexual functions, the so-called normal and abnormal, such as penile erection, ejaculation, uterine contraction. So it's a complicated dance that takes place with varieties of hormones. We can focus on this, this estrogen helps the uterus grow and maintains the lining, uterine development, and regulates other hormones. For example, progesterone is necessary for establishment of placenta, which we talked about. Prolactin is a male hormone with breast milk production. Relaxin prevents premature birth. Okay, and oxytocin, which we talked about, the start of labor. Okay, and the follicular human chorionic gonadotropin, that's the earliest sign of pregnancy. That is the one that can be measured. Okay, in the early pregnancy test, because that's the earliest rise that takes place, right from the beginning, and that even the tiniest amount can, so it is detected in the pregnancy test. So this is just a basic overview. We are not a medical school class, so we'll just go over that, in just for completeness of sake. Okay, all right. And now again, the varieties of hormones, and animals have a different thing. So starting with the leeches, which are hermaphrodites, okay, and now these, when they're injected, with certain chemicals, that is a chemical which is similar to vasopressin, from snails, they start floating, and they change their behavior type thing. So then these hormones have a long evolutionary tree going back to about 700 million years, and so this is, and the sequence of amino acids have been conserved to the male. And so this is one of the other hormones called vasopressin, has also to do with, working on your simple phenomenon of bedwetting type thing. So you can just see that a lot of the amino acid sequences there are just slight subtle differences that have taken place. And even going down to the most earliest animals through the animal kingdom, anapressin, this is in the lowly worms and insect, as you can see how nature has used what was available. So that's a good example of learning. And these are all, these are all enzymes and chemicals that are secreted. In turn, the cycle is controlled by varieties of genes. Okay, and if these genes are abnormal in, say, for example, in chimps, their behavior drastically changes. They become violent, harassing the female, and also has development effect on their brains. Okay, and this is again in more detail outline the difference between androgen, which is the male sex hormone related to the male sexual characteristic, estrogen, the female hormone, okay, male, female, okay, testosterone, estradiol, okay. There are two varieties of other chemicals that are slightly different where they are produced. So this is a nice summary of a lot of the stuff that we have talked about. And these are the chemical formulas, which you can just see that the underlying cholesterol is based on cholesterol type molecule, the 5-chain chemicals that are. And a lot of these are just slightly different by various OH group or so-called hydroxyl group. And these were isolated in horses, and a lot of times the surgery was done by removing testicles in animals, and then a lot of these testes were implanted later on in the abdomen, and the hormone still worked, and that was the origin of the word hormones. Hormone means arousal that takes place, so this is a complex dance that takes place of varieties of hormones, the estrogen, the progesterone, the testosterone, okay. And females also do have a small amount of testosterone, okay, and that is produced by their adrenal glands, by the way. Okay, now this is the classic line diagram of female hypothalamic axis when at the follicular phase, the so-called gonadotrophin release hormone that goes through the pituitary and the follicle stimulating, and the luteinizing hormone takes place that affects the ovaries and causes estradiol. Estradiol again has a reversing effect on the hypothalamus and prevents the excessive secretion. And the mid-cycle again similarly that takes place, that this is the, instead of feedback mechanism, it is a stimulatory effect, and the luteal phase again the inhibitory effect. Okay, sometimes it's illustrated with a negative sign. On the other hand, in some of the technical papers, you'll see instead of the arrow, there'll be a straight line here. So basically, so it's the feed forward with the excitatory versus inhibitory effect. Okay, and so these were isolated back in the 1930s, and the testosterone followed shortly thereafter. And there were some researchers that were made a big business out of giving animal extract and injection, and the varieties of celebrities, made for getting those testicular injections. Okay, with one of the scientists who was the founder of this, and he took self-injected himself. Okay, and this may surprise you that the hormones do have even a subtle, less known effect. I think on my earlier talk I had a slide that the so-called dancers that and the exotic dancers, they get more tips during their ovulation. So this was again, so and that in the same way, even the women, without realizing, they will dress much more in an attractive manner and become more flirty at the time of ovulation. So we are all creatures to our masters of our hormones in our brain. Okay. So we are hardwired with love and sex from birth to the attachment. So lust has a lot to do with attraction related to the hormones. You can just see that this is a cynical or perhaps more scientific way of looking at it. Okay, lust or attraction is related to the classical hormones, attraction related to noradrenaline. Okay, and dopamine and role of serotonin, which is the inhibitory effect, which has this serotonin level has related to depression. Attachment is related to oxytocin and vasopressin that are produced from the pituitary gland. Okay. Okay, and again, so this shows it in more detailed area, the same thing, that we talked about. So we're also basically hardwired from infancy onwards, type of thing. So, okay. Okay, so and different males and females have a different response to the hormones. For example, women are attached much more emotional, and they would associated with feeling of love, and sometimes there are. And okay, so I think that people have a lot more personal knowledge on this, so I shan't elaborate much more on this. Okay, and continuing, that a lot of times the female scientists do not get much credit, but Dr. Georgiana Seeger-Jones, she isolated varieties of hormone from placenta. Okay, and then. And she had submitted varieties of paper which were not likely to be accepted under a female name, okay. And she discovered the first, hormonal and the testing that, the work she did, pioneering work type of thing. And it took a while for the US to catch up with the so-called test tube baby and this thing. So, and she was doing a lot of research on the placental, pathophysiology. Okay, and then initial research was done on rabbits for pregnancy and placental effect, hormonal effect. Later on, they switched to hormones. Okay, and at the same time, the medical science and society in general was so discriminatory against females that, in spite of being a respected research scientist, she was not welcome at a posh Maryland dining club. Okay. Now, sometimes, the sex can be a very fluid, this thing. And I think before we stop for today, we'll talk about this famous case of Brian Deboney. So he was born with an internal female organ and with a small penis, hypospadias, internal uterus. Okay, and there were attempts made that with sex change operation type of thing. And initially, then finally the surgery was done without the teenager's consent. Genetically, it was a female. Okay, and then finally, in spite of the surgery, she made a self-discovery and went back to being female. Okay, so this was, some of the earlier experiments that were done by varieties of psychologists and surgeons, that was before the knowledge and the clear-cut understanding about sex and gender and genetics. So the interesting case that you can look about, look up the word Cheryl Chase, activist for the Intersex Society, so that was in the early days of. Okay, so I think we should probably stop here at this stage, and I will continue with the talk with the next part. Okay.